Dr. Wadell, and thanks for joining us. I was hoping that you could talk with us today a little bit about your organization, Mission Heritage, and how you were able to align your goals as a not-for-profit with membership medicine.
I think first of all, as medicine has been evolving over the last few years, organizations want to be able to meet people, patients at all avenues of entrance into a system, whether that be through ACO models without managed care, whether that be through a PPO model, whether that be as we are a faith-based organization and nonprofit, we care for the poor, so some are on federal assistance. You have to meet all the patients that you're going to be experiencing. I always relate it to a person who has a retirement account. You have multiple investments, whether it be safe investments or more risky investments. You have a wide variety of them. I felt that it was important as we moved in this medical environment that we were able to capture patients that we may not have been able to capture in the past with a concierge program. For many patients, concierge is convenience in the sense of being able, if they're busy professionals, they have the ability to access their physician quickly and get their problem taken care of quickly. For others with chronic medical conditions and health issues, concierge medicine for them represents a way for the doctor to spend more time with them, to really look into their chronic medical issues, to be there when there is crises. That was a need that I felt we had. So I had to balance that, though, with who we are as an organization. And we do cherish taking care of those who are underserved. And in our program, we earmarked a certain percentage of our fees to go back to the community. We have donated hundreds of thousands of dollars over the last several years of our program to our foundation to help the community in the building of our new hospital tower, and also to our underserved populations in the area. So I felt that that is how we were able to balance it and still be reflective of who we are as an organization, while at the same time meeting the needs of the demands of the patient population that we serve, with the added benefit of trying to help those in need.
That sounds great. So you actually use proceeds from the membership program to serve the not-for-profit sector of your business.
Yes, we set aside a portion of the fees every year, each physician in the program, to help those who are underserved, and those monies have to be used to help the entire community in which we serve. So it can't just be earmarked towards a certain segment of the population. It has to be the entire community can benefit from what we're using the money for.
Right. And so can you talk a little bit about your patients and the patients that you serve? And do you think that they notice any distinct difference in the care, the people that aren't members, I should say?
That are not members?
Yes.
I think that I always relate it to an airplane, okay? A pilot, right? If I'm flying, I'm in the Los Angeles area. If I have to fly from Los Angeles to where you are in New York, I can fly economy, I can fly premium economy, business, first class, whatever. As a pilot of the airplane, as a physician, in concierge medicine, your care doesn't change in the sense of acuity. So it doesn't matter if it's a concierge patient or a patient who is not in our concierge program within our panel. They are triaged according to what is wrong. Right. Why? Because a pilot has to get you from Los Angeles to New York safely. I try to treat all my patients identical. I think for concierge, I think there's the executive physical, which is a hour-long visit, which in these days with physicians, with the time crunch that we have, that's a lot of dedicated time with your physician going through your social history, your family history, your surgeries, your exercise, your diet, I'm doing a complete physical examination, head to toe. I'm asking you a complete review of systems. I'm delving into all of your medical problems and trying to make them as fine-tuned as possible. Not that I can't do that with my other patients, but that hour does give me a lot of time to really concentrate on the individual. And I think that's one benefit of the concierge program. I think the other benefit, to be quite honest, is the ability to be able to contact me with your medical concerns 24/7, 365. And that I think gives people, especially those with those chronic medical conditions that may need some help. Maybe we avoid that ER visit, right?
Right.
They don't go to the ER because they're able to nip the problem in the bud. Um, that's not to say that patients don't end up in the ER on concierge program, but nonetheless, you're going to try to mitigate that by being there for them.
And sometimes it's just the peace of mind, knowing that they can reach you if they need to, you know, even on the
Right. I mean, they
weekends
have.
or right, and it's worth it for that. And just to be able to serve the whole range of patients, including those people who just want that extra comfort, um, can make a difference. And
Right. And concierge patients come from all walks of life. Some people, if you think about what you're paying uh, for certain aspects of your life, your internet,
right.
phone bill, if you have a gardener that comes out, cuts your yard,
Hmm.
you know, how much you paying them, and what, if you really look at the breakdown, how much you can be paying to have your physician basically there for you the old fashioned way. And I think for us as physicians, with the way things have gone in medicine, and the time crunches and everything, this is a refreshing thing because it gets us back to who we are as physicians, to be able to spend the time with the patients, like the Marcus Welby, right?
Right.
The old black bag going to your house, right? I have made several house calls, as part of the business if they can't make it in. So, I think that it's an honor to be in a patient's house, right? They welcome you,
Yeah.
and you get to see a lot of things that you maybe not see. Like maybe we should get rid of that throw rug over there, get a trip on that, those kind of things. But I think concierge medicine is something, for people who need it, whether it be convenience or whether it be the need of better, not better, but I would say the need for uh, focused care and time with their doctor. And that's the way I look at it.
That's great. Well, thank you so much for joining us today. And I really appreciated your insights into how Mission aligns their commitment-driven goals with membership medicine and how it works for patients having the choice.
Yes, your concierge choice, right? They have a choice. I'm happy to serve them in any way. I just feel like it's another added layer of benefit for those who want it. And I felt we as an organization, at least in my mind, I think as we were evolving through what primary care is going to be looking like, especially in the future, um, with more extenders, with like PAs and NPs, you needed to have that. So that's kind of where we're at.
Great. Well, thank you very much and have a great afternoon.